Lost my crease 1 month after Muellerectomy. What are my options now? It's been over a month and my eyelid crease hasn't come back in my right eye after Muellerectomy. It actually created a second crease a few millimeters above it. I got it for medical reasons since it was covering my upper vision at night. And now I'm worried insurance won't cover a revision since it would be cosmetic. My surgeon said he'll check in a few weeks from now, but I think at this point I should look elsewhere. Is it swollen maybe?
Thank you for your question. You submitted your question requesting further explanation of a situation where you underwent ptosis surgery using a method called Mueller's muscle resection. And you are 1 month out after that surgery, and you're concerned because you lost your eyelid crease. And you have also noticed the development of a slightly higher crease. And you're concerned that any further surgery would not be covered since it was covered by insurance for the ptosis part, that any revision surgery related to the crease may be considered cosmetic. And you've met with your doctor who is planning to see you in a few weeks, and you're concerned that maybe it's better for you to go elsewhere. Well, I can certainly share with you a perspective based on this information that you provided. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Cosmetic surgery is a core of my practice, and as well as medical surgery such as ptosis surgery. And unique to your situation is, of course, the Asian eyelid anatomy that is relevant to this type of healing process. So to begin with, as you are well aware, Muellerectomy, or Mueller's muscle resection specifically, is a shortening procedure that is done to help people with drooping eyelids from behind the eyelid, which allows for a certain generally predictable level of eyelid height improvement. And so the front of the eyelid is essentially untouched. Now, just to review some of the anatomical principles of Asian eyelids, it's basically the crease that is present naturally in 50% or so of Asian people is due to the presence of attachments of the fibers from a muscle called the levator muscle. The levator muscle is responsible for most of the eyelid movement, and those fibers attach to the skin. Now, when you do Asian eyelid surgery, whether it's a non-incisional or incisional procedure, the goal is to create a connection between the skin and that muscle. Now, given that you are 1 month out since the surgery, I think a reasonable understanding can be made of or explanation can be that there is still, of course, some swelling, and swelling can certainly affect crease presence as well as the variability in the crease formation. I think that as long as your doctor is following you, this situation can be appropriately monitored. I think a lot of times people get concerned about missing an opportunity to do something relatively early, and so they start to get anxious and want to look elsewhere. But I would say that from my perspective as someone who does a lot of Asian eyelid surgery, that in a situation like yours, I would wait several months to allow for swelling to resolve. In addition, given that this type of surgery was done from the inside of the eyelid, I would also be concerned about putting stress on any of the tissue that is healing while this process is ongoing. For example, when you do a non-incisional Asian eyelid surgery, what we're doing is we're making little openings on the skin. And so let's say, for example, we want to try to create a crease because you don't have extra skin, you just want to create an infolding or a double fold or double eyelid. Well, you make little openings on the outside of the skin and you pass a stitch from the inside out and to try to create this connection. Well, part of that procedure is to actually flip the eyelid. Well, flipping the eyelid and putting stress on it could potentially separate some of the tissue that was so meticulously connected when you had the Mueller's muscle resection procedure. So I would say that it is possible that swelling can resolve and your natural crease may come back, or it might be that the crease became less defined or separated because of just the natural part of the healing process. Sometimes swelling can cause this type of effect, and it takes several months to wait and see what happens. And further, I would probably say that from my perspective, any type of surgery to try to recreate a crease would be based on the surgeon's preference, maybe an approach from the outside to remove skin, or to do it from the skin side directly to the levator muscle, or to do the non-incisional, again, depending on surgeon's preference. But I think at 1 month, it's a little early to make those kinds of decisions. I think that if you're satisfied with the eyelid height and the appearance and the symmetry, that you allow time to transpire until you are in a better position to ensure that no further complication to the original surgery would occur by doing an intervention that's too soon. So I hope that was helpful. I wish you the best of luck. Thank you for your question.